Hi, I'm Niamh Healy.
Hi, I'm Mim Hannon Moran.
We're both fully qualified birth trauma resolution therapists, and we'd like to help you understand more about birth trauma and what we can do to help.
Between us, we have over 30 years' experience as antenatal teachers and tutors. Over that time, between us, we have also taught pregnancy, relax, stretch, and breathe classes, gentle birth workshops, infant massage classes, and supported families with breastfeeding support and doula work. So, let's have a look and see how the brain processes memories. When we experience events, the brain gives it emotional context before storing it as a memory. For example, a pleasant restaurant dinner, where the brain contextualizes it with the food, the staff, the ambience, and then stores it long term as a past tense story. The brain likes to pattern match and can do so with specific details from our memories. That's why we can be brought right back to a childhood memory through a smell or even a song. However, when we experience a traumatic event, the brain is flooded with the stress hormone adrenaline. This stops it from contextualizing the events and causes it to be stuck with the present tense, fearful responses and emotions still attached. When the brain pattern matches and becomes triggered by a sensory reminder of the traumatic event, like seeing or smelling something, the person experiences symptoms like panic attacks or flashbacks and the same intense, present tense emotions from the event. Sometimes these triggers are obvious, like hearing a birth story, but sometimes these symptoms can come out of the blue. For example, being triggered by a specific word or a color that they haven't consciously associated with their birth experience. This can be very confusing and unsettling. 80% of people can process a traumatic event themselves within 4 to 6 weeks. However, the remaining 20% find themselves still being triggered, living in the present tense reactions to any pattern their brain matches to. In some cases, their baby or their partner can be the trigger, so the trauma symptoms are relentless.
Wouldn't it be nice if birth was a lovely, positive event for everyone? But we know that that's not the case for a lot of parents. During pregnancy, most parents think that a healthy baby is the most important thing, and it is, but it's not the only important thing. It's important that parents are left emotionally and psychologically well, not just physically or clinically well. Some people are disappointed or upset by their experiences, and listening and validating can be very helpful for those people. However, others find that their experience leaves them with temporary or long lasting symptoms of trauma. Some will even have post traumatic stress disorder. 30% of parents describe their birth as traumatic, and it is estimated that 8% will have full blown PTSD. Birth trauma mostly affects mothers or birthing people, but can affect fathers or life partners or other birth partners too. And we're using the term birth trauma here, but loss at any stage in the parenting journey or fertility struggles can cause trauma too. There are some very obvious causes of birth trauma. Rare life-threatening events for mother or baby could cause PTSD. And I don't think horror stories are helpful, so I won't give examples here, but I'm thinking about the very rare but extremely serious situations that can happen, unfortunately. The fact that some other serious events in labour are more common doesn't make them less traumatizing to parents. So, for example, emergency cesarean, forceps, epidural not working, fetal heart concerns, baby needing some resuscitation, baby spending some time in NICU, or perhaps even extremely fast births where the baby is born on the way to the hospital and so on. These are situations that most people can understand would be very upsetting. What's less obvious is that how a mother was treated at any time during her care can have a lasting impact on her. Examples could be staff being unkind, or dismissing or disrespecting her, or disregarding what she's saying, or not involving her in decisions, or not getting true consent for procedures. Offhand words or certain tones of voice can have a far greater impact than most healthcare professionals realise. Ultimately, it's about how they felt. Were they scared? Did they fear for their life or their baby's life? Did they feel that they had no control over what was happening? Did they feel that they had no voice or that nobody was listening to them? Did they feel trapped in the situation? Did they feel lonely and unsupported for a long time? Parents may not think that their feelings around how they were treated and how they felt are valid if the outcome was ultimately okay, but their feelings are just as valid as after the more dramatic clinical situations. So let's have a look at a couple of stories. We have Mary and Joan. And Mary had a straightforward enough time going into spontaneous labour and birthing her baby vaginally. Joan, however, had her labour induced, was pushing for a long time, had 2 failed attempts at forceps, and ended up with an unplanned caesarean. So it might seem obvious that Mary is less likely to be traumatised than Joan, but let's take a closer look. Mary spent a lot of her labour alone and frightened. She didn't get the epidural she wanted. She felt staff didn't listen to her. She and her baby were too shocked by the fast birth to enjoy skin to skin in the golden hour. She doesn't know why she feels so unhappy about her birth, as she knows it was quite straightforward. Joan, on the other hand, negotiated her care every step of the way. She went home after the first step of the induction process. She felt fully involved in the decision-making at all times. She felt respected and listened to at all times. She felt positive about her birth, even though it wasn't what she had hoped for. So you see, the clinical summary of how labour and birth went doesn't tell us the whole story. People, family, friends, around new parents make all sorts of assumptions. And we know society sends parents clear messages about just getting on with it, regardless of the birth journey they've had. This societal expectation of parents to embrace parenthood, no matter how their birth experience was, is completely unreasonable. A good outcome being a live mother and a live baby is a very low bar to set. There's a good analogy for that. There's a person who wanted to go to Disney World for years, really wanted to go there with their family. They saved up and booked a trip, couldn't wait, arrived at the airport so excited, got on the plane, enjoying the movies. Then they were hijacked and held at gunpoint for several hours, not knowing if they were going to live or die. Thankfully, they were rescued by a SWAT team and they were able to resume their journey to Florida. How likely were they to enjoy the Disney parks and their holiday? Should we expect them to have positive memories? How understanding would family, friends, society in general be about their inability to embrace their dream holiday after what had happened to them? Contrast this with how society expects new parents to act or feel in the early weeks and months of parenthood.
Diagnosing PTSD and PND isn't clear-cut, unfortunately. The current method to diagnose PND is the Edinburgh Scale, which lists symptoms of postnatal depression such as sadness, anxiety, worry, difficulty looking forward to things. Many healthcare professionals do not have access to or knowledge of PTSD diagnostic tools, which look for key PTSD symptoms such as flashbacks, panic attacks, avoidance behaviours, hypervigilance, etc. They each have some very different symptoms. For example, postnatal depression symptoms include feeling unable to laugh or see the funny side of things and not looking forward to things. PTSD symptoms include intrusive thoughts and memories, nightmares, flashbacks, and avoidance behaviours. Parents have told us the lengths they go to avoid passing the hospital where they have given birth, or needing to change the channel if something about birth comes on the television. However, there is an overlap with some of the milder PTSD symptoms, which often means that people with PTSD symptoms may not be identified effectively. For example, feeling anxious or panicky is a symptom of both. Another symptom that overlaps is not looking forward to things or feeling there's no hope for future events. Difficulty sleeping can be experienced by both PND and PTSD. Inability to see the funny side of things and loss of interest in things or feeling disconnected can often confuse diagnosis. And we could continue with other symptoms that overlap. So you can see that it would be understandable that a GP would misdiagnose someone as having postnatal depression if they're only using the Edinburgh Scale. Whereas if they asked a different set of questions, then it would be obvious that the trauma was the core issue. Misdiagnosis poses its own issues, as the person will now be offered treatment for postnatal depression. The treatment for postnatal depression can exacerbate the issue, potentially leading to re-traumatizing the person. In particular, talk therapies, as they invite the person to talk through their experiences again and again, forcing the person to relive it repeatedly. Medication, which may be effective for postnatal depression, will not treat trauma. When a person does not recover from their trauma, it can lead to them developing depression, which in turn makes further diagnosis less clear, as the picture is now more complicated. Treatment for PTSD is different. It requires sensitive debriefing about their feelings and not necessarily about the details of their experience. Then we use specific, individualized therapeutic techniques to help them recover fully from their trauma.
So what is birth trauma resolution therapy? It is a very solution-focused, fast and effective therapy, usually only requiring 3 to 4 sessions, averaging about an hour per session. We can treat people with full-blown PTSD or those who have subclinical trauma after their perinatal experience or any other traumatic experience around birth and pregnancy. And it involves using a range of therapeutic techniques to eliminate trauma symptoms and to help rebuild the person's sense of self and positivity. The rewind is the key technique. It converts the traumatic memory with those intense emotions and reactions into a normal memory with a story, with a context. The rewind eliminates the worst trauma symptoms, so the person no longer has any flashbacks, no longer has any panic attacks, no more intrusive thoughts, and are no longer triggered. Now the mother is able to think about her birth experience objectively and without getting triggered. It's not about sugarcoating what happened, it's about giving it context. Sometimes positive memories can surface from their experience that had been eclipsed by the trauma. We personalize other techniques to help rebuild confidence and resilience. For example, we often work on confidence facing into a subsequent birth. This is common as often a mother only realizes the extent of her trauma when pregnant again. We can work on relieving guilt and other negative emotions, or on improvements in personal relationships, as trauma can sometimes make a person withdraw from those around them. Clients often tell us that they feel more like themselves after just a few sessions, that they are able to engage with their future with hope and positivity, and that might include making family planning decisions from a place of balance rather than from fear.
So how can you help yourself? Finding someone to listen to your story with kindness and sensitivity is a great start. Someone who will validate your feelings and remember that how you feel about your story is what matters and not the details of the story itself. If you are less than 6 weeks postpartum, it can be really reassuring to remember that 80% of people will be able to resolve their trauma naturally. Remember, what you are feeling is a normal reaction to your experience, and there is support out there to help you fully recover and be yourself again. Book with myself or Niamh for a free initial call for a short debrief and a screening discussion to help you decide if BTR will meet your needs.
We've been blown away by the results we get with clients. It's very gratifying to be able to help parents resolve the lasting effects of their trauma so that they can get on with their lives. Don't just take our word for it. Here's a couple of examples of what clients have said about this therapy with us.
I wasn't sure what to expect when I began working with Mim. I wasn't sure if anything would help change my perspective on my first traumatic birth in hospital. I can wholeheartedly say what Mim did was magic. It completely transformed my view on my birth, so I could look back at it and appreciate the journey that brought my daughter into this world, rather than the anger and resentment I felt for years. In turn, I had the most relaxed, beautiful home birth. My son is the most relaxed, placid little boy, and I put it down to having a relaxed pregnancy where I believed I could have the birth I dreamed of and deserved. Having a positive birth experience was life-changing. Thank you.
I highly recommend this treatment for anyone who has had a hard time surrounding birth. I found my sessions with Niamh help instantly with my anxiety relating to the traumatic birth of my first little girl. As we went through the different steps of the birth resolution therapy, I found my fear of something bad happening to my little girl disappear. I've since had an empowering experience birthing my second daughter, and I went into the same hospital without fear. Thank you so much for everything. If you'd like to know more, please book a call with us via our website, mybump.mybirth.mybaby.ie, or through our social media. We look forward to talking to you.
Thank you.
Thank you.